Hi, I'm Gail. I'm a lactation consultant, and today I'm going to demonstrate how to use the Ameda Platinum breast pump. So the first thing you're going to need is the pump. The second thing is a hygienic kit. A hygienic kit will be in your storeroom, and this is sterile, so you can open it up and use it right away. Basically, the hygienic kit comes with two setups. These are the two that will be used on the breasts, and it's already put together. Basically, you're gonna wanna just take this adapter valve and plug it right into the only spot it goes, the hole in the front. Now, sometimes moms might want to do just one side because maybe it's uncomfortable for them. They might have some sort of carpal tunnel, or maybe they just have very large breasts and it's just hard to do both at the same time. If that is the case, you can unhook one side and seal it up and go ahead and plug it in that way. We recommend that you do both sides if possible, but it's not always necessary. So basically, you're going to turn on the pump right here with the red button. Bring it closer. This first screen is speed. It's cycles per minute. So this is just basically how fast the pump sucks. You always want to mimic a baby's suck, and in the early days, babies tend to have a continual suck. I mean, they might take a break, but it's not really changing at this point. I like to say just leave it at 80. It's just easy and one less thing to worry about. The middle section is the suction button. This is going to be how much and how hard the pump sucks. It does go up 1 by 1, but if you press and hold, it'll go up 10 by 10. And the same thing goes for down. The recommendation is that you go as high as you can with no pain, and that might change. I'm constantly telling moms to assess where they're at in that moment, especially if they've had any nipple damage or anything at all, maybe from a poor latch. You might want to take the pump down. It's important that moms know this, that pumping should never hurt. And even if they're not getting anything at a certain suction, if it hurts to go higher, she still will not be getting anything. So we want to make sure she goes as high as she can with no pain. Now, the final screen here is the timer, and we typically recommend that moms pump 15 to 20 minutes about every 3 hours or so. Now, that's definitely negotiable and doesn't always have to be that way. But it's just easy, I think. Every 3 hours, 15 to 20 minutes, it makes it easier. This timer, if you need to restart it because you're messing with settings, you can just press it and it'll restart the timer. It does not go off automatically, so the mom will need to pay attention to that. So basically, you can turn it off here. Let's say 15, 20 minutes is up, and now the mom needs to open it up and get the milk out. So depending on how old the baby is, she might be getting more or less. I like to suggest that we always use these colostrum bottles. They come in a package that looks like this in the beginning because it's very hard to collect, half a milliliter in a giant bottle like this. This is her bottle. She can leave it on the side, and moms with an older baby will probably be using something larger anyway. But at least in the beginning, we really want them to use this colostrum bottle, and it fits perfectly here. So if she has been using this and she just has a few milliliters, she can use a syringe and get that out. If it's more and there's more volume, she can store it as this is or give it to her baby in a bottle if that's what she's doing. Basically, you're going to take this off, gather the milk, take the tubing, pop off the adapter cap. This is on there very well. Don't separate it. Moms don't really need to wash this tubing because it shouldn't be touching the milk at all. It's just air passing through that tubing. So I like to keep that with the pump, just keep it on the side. The next piece is called a diaphragm. This also helps with the suction, but it shouldn't be touching the milk. Put that on the side. We don't need that. We do need it, but we don't need to wash it. This is the valve. You can pinch this right off. This used to always be white, but these days it's clear, so it's hard to see sometimes, but it does not work. This is the first thing we like to troubleshoot. If mom says the pump isn't sucking, then it's probably because she's missing this valve, and you can just pinch it right off, and you will need to wash this. Then you've of course got the flange, And these two pieces definitely will need to be washed and for use for the next time around. We like to use Castile soap. We have these in our storerooms as well, and they look just like this, just a few drops, and you can mix that up with water, wash the parts, rinse them, and air dry. So basically, let's put it back together. You'll definitely need this valve, the bottle, the diaphragm, and finally the adapter cap here. Now, if the mom is complaining of pain and you've figured out that the suction seems to be okay, we do have larger flanges and they come in a box like this. This is a standard flange size. It's measuring the diameter here of the tunnel. This is the standard or small. It's a 25 millimeter. If the mom needs something larger, then we have the larger flanges, which this is the medium and the large, and this is the 28.5. It's an insert, so that's the next step up. And then of course you've got this next one, which is 30.5 millimeters. It's tricky to have the insert, but you can work with that. It fits really well. It works just fine. It's just a little bit harder to see on the side. But I would definitely recommend not automatically going to the higher one, because really this might be exactly what she needs. You don't want to go too high because that starts to pull in more breast tissue, and that might be painful as well. We also have extra large and a 2X. These are even larger. These go from 32, the 32.5, and this is a 36. So we really want to make sure we get the proper fit for the mom's nipple size. Okay, the final thing I want to talk about is we have in our storeroom manual pumps. So this looks very similar to this package, but this package has 2 bottles in there and the caps and the tubing. This one, is the manual pump, has only 1 bottle and it has a handle. So if the mom, and you can give her that, if she just needs a manual pump, you've got that. Basically, the difference is you can take the tubing cap off and the diaphragm out. Take this little handle, put the white piece down in the tunnel up here at the top, and there's a little groove right there, and just pop it right in. We recommend the mom slide their hands up, hold it firmly, and then just press and hold. Pretty cool. So you can pop it out, take it off. Again, this piece doesn't really touch the milk either. Just slide it right in, and she's good to go. We do have in our storerooms just the handle. So if the mom already has the kit and she just needs a little handle, we do have this in a separate package. Again, sliding it right in, kick it right in. There you go. That's it. So that's it for today, and good luck and happy pumping.